and good morning. It is now March 5th, 2024, and I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. Our first patient for surgery today travels here from
Naples, Florida.
all the way from Naples, Florida. He's had horrible back pain for years, and he has neurogenic claudication in both legs. He has leg symptoms with standing and walking. He also has facet pain. So we're going to fix 5 spots on the disc, 2, 3 on the right, 3, 4 bilateral, 5, 1 bilateral, and then we're going to fix the 4, 5, 5, 1 facet joints, all part of one surgery. So you're welcome to ask questions. And he has a stimulator here, bladder stimulator. A little bit of numbing medicine, okay? Just bear with it. Don't move. It's Dr. Deuk. You're doing great. Don't move. Okay? So I'm going to give him a little numbing medicine under the skin to make things a little more comfortable. But, of course, right away it won't be comfortable because we're injecting medicine. And nobody likes getting medicine injected. You're doing great. Hang in there.
Lay nice and still.
All right. So we've got 5 needles to place. We'll start with the 5-1. Feel free to ask questions. Just lay still.
You're doing great.
Now, to make matters more challenging, this patient does not tolerate fentanyl, which is a pain medication. That's what we typically give our patients during surgery at this moment so that they're more comfortable. He doesn't tolerate it. So we are not using fentanyl per his request. And as a result, he's having less pain blocking that we would normally have with anesthesia. But that was his request, so we're going to honor it. Shot? All right, if you have questions, feel free to ask. But let's start, Henry, with why do these discs get damaged and cause so much pain for patients? What is the mechanism by which they cause this pain? Shot? Welcome back. And you can see how discs cause so much symptoms in patients. It's due to inflammation. Shot? All right. And the inflammation actually comes from an area in the back of a disc called the posterior annulus. And what's happening, folks, is you get a tear in that annulus, which is really a wall. It basically is there to keep the nucleus, which is the stuffing of the disc. It's there to keep the nucleus in its place. The problem is when I'm going for 3-4, num shot. The problem is when you get a tear in that wall and the nucleus starts coming out through the tear, it gets stuck within the tear, and that's where the inflammation takes place. So it turns out the nucleus is highly irritating to the body, and your body is not meant to See the nucleus, shot. It's located normally deep inside. Lay still, you're doing great. Everything is fine. Lay still, the nucleus is located deep inside the disc, hidden away, shot, from the inflammatory system, your body's inflammatory system. Shot. Okay. You're doing great. Shot. Let me know if you feel pain. A shot, AP. So when the tear happens in the annulus and the nuclear material escapes into the tear and out, called a herniation or bulge, then, thank you, then what happens is your inflammatory system attacks it. And that's where the pain comes from. It's the inflammation. So chronic back pain comes from inflammation in a herniated disc. About 87% of patients with chronic back pain. We did the study and we found this out. Lay still, you're doing great. Don't move.
Just relax, my friend.
Shot? Huh? What's he say? Yeah, of course it hurts. We can't use fentanyl, so you're going to have a little more discomfort right now until we put you out completely. But I need you awake. You're doing great. Just hang in there. Shot. All right. Well, we're in a good spot, and I'm not going to take this out. I will need to put a new needle on the right side at L2-3. I cannot go through the same incision. So I'm going to, well, I might be able to. Let's try. Huh?
Yeah, the anesthesia.
Shot? Yeah, well, the angle is. Look at that. See, the curves. If he didn't have lordosis, I wouldn't be able to do this. Shot? Any questions from the audience?
At this moment, no current
I need
questions.
you to keep the hand very still.
Yeah, lay still.
Very still. You have an ID in it.
You're doing great. Everything's okay. Shot? I may be hitting the transverse process, but that's exactly where I want to be right now. Shot? It's looking good. I think the TP may be pushing me. Shot? Where are you feeling that? Yeah, I'm going to have to start higher. Num. Lay still. You're doing great. We're going to have you asleep in 10 minutes, okay? I just need you to lay still. So our patients are always awake, and when you hear me talking to them, it doesn't... Are we still live or not? Am I live or not?
Yeah, we're live.
So when I talk to them, it doesn't mean that they're actually awake to hear me, but I talk to them to reassure them anyway. So I get a lot of questions about, why aren't the patients asleep? Well, they probably are asleep, but I don't know if they're asleep or not. There's no way for me to tell. And I'm going to assume they're not asleep, and I'm just going to talk to them and just comfort them and let them know everything's okay. Any questions? Lay still.
At this moment, no
Shot?
current questions.
All right, so I'm hitting the facet. I need to get around it. There we go. Shot. Please bring the collimator down a little so my fingers aren't getting irradiated there, Jordan. Okay. Shot. Shot. AP. Let's show the audience what we're going to do here endoscopically to fix these discs. There are 3 discs. 2 of them are damaged on both sides, and 1 of them is on the right side. We're going to try to fix all 5 spots with the laser surgery. This way he can avoid a major fusion surgery, which is too invasive. Excellent. Welcome back. You could see from our video, right, Henry, that the procedure we're doing is going in and removing the source of pain, which is the inflammation happening in the back of the disc that's painful. In his case, he's got 5 areas that need to be fixed to get rid of that pain. Shot? And we're going to go fix all 5 today in one surgery. Shot? And 5 areas is as much as we can do in a surgery. We've done 6 once before, but we generally will do 5 at most. And that's because the surgeries will start taking too long to do. We can't have the surgery taking too long. Shot? It's not good for the patient to lay on the operating table. Shot? That long. It's not safe to be under anesthesia this type for that long. So we want to limit our surgeries to around 2 hours, plus or minus. Shot? Jeez. Shot? Trajectory looks good. I'm trying to get into the 5-1 on his left side. Shot? L5-S1 is the hardest disc to get to. Shot? And the reason is because of the patient's anatomy. Shot? They have the high iliac crest. They have enlarged facets. In his case, he has very enlarged facets. Shot? AP?
Stay still, my friend.
Lay still. We're almost done.
Almost done. You're doing great.
We're going to put you to sleep soon. You're doing amazing. Just hang in there a little bit longer. And he didn't, for those of you who joined late, he did not want fentanyl. Fentanyl is a pain med that we use in surgery to help people with their pain. Lay still. Let's face it, nobody wants a needle stuck in their back, right? So, yeah, not really, he said. Shot? So basically, we want to avoid too much pain because it's going to cause him to move. Shot? Let's go AP. Where do you feel that? Where do you feel it? In your back? Yeah, in his back. Not down his leg. Shot? That's good. I think we're there. Yeah, nice. Shot? All right. Nothing down your leg, right? You're doing awesome. You're doing awesome. Yeah. Shot. All right. Well, let's can I get to 3-4 from here? I'm going to try. We have to make an incision here anyway, so I'm going to try to get to 3-4 from here. If I have to make another incision, I will, but let me try this. We try to get as many needles placed through one incision as possible. And the reason for that is obviously fewer incisions, less bleeding, less chance of complications. Shot? So sometimes I can do it where I can get it all in one incision. Shot? Sometimes I cannot. It just depends on the patient's anatomy. Let's do some num-num. We're going to give him some more numbing medicine. And the numbing medicine's wonderful. It doesn't work that great, but it helps a little bit. And it can actually numb the nerves so that some patients can wake up with some numbness, from the medicine, which we don't like. We don't want that. Shot? Lay still. We're almost done. You're doing great. Shot? All right. That looks really good as far as the trajectory. Let's see if we can sneak past the transverse process and the facet. A lot of people don't appreciate the transverse process. It gets in the way. It's tight from all the bone spurs. Shot, but I think we might have gotten it. Yep. Lay still. Give me an AP. So we're going to get this L3-4 on the left through the same incision as the L5-S1. Then we're just going to have to go in with the scope and fix both discs on the left side. Perfect. Looking really good. You're doing great. We're going to have you asleep in about 5 minutes. We just need to do a few things, all right? You've done great, and I appreciate your patience with us. All right. If you have questions, feel free to ask. Hopefully you enjoy the new animation videos. Shot. Henry, which do you like better, the old or the new?
Of course, definitely the new.
Oh, I had to ask.
Of course.
All right. So this gentleman has had back pain for years. How many years have you had back pain?
How many years pain, my friend?
When did it start? How many years ago?
40 years.
40 years.
40 years.
All right. Can you guys see this? Oh, we're not on the animation, right? Yeah.
No.
So he's had lower back pain for 40 years. 40 years of his life. Can you imagine having pain every time you got up and did something? Try to go to the gym, you have pain. Stops you. You try to go to dinner, you have pain. Stops you. You try to go hang out with your grandkids, it stops you. 40 years of back pain. It robs people of their life. That pain is going to be gone today. That's what we're going to do for him. And only at Deuk Spine. We're the only place in the world that can really get rid of back pain because, number one, we know where it comes from. Other doctors don't. And number two, we have the most advanced treatment in the world for each source. Today, his pain is coming from 3 discs. So L5-S1, L3-4, and L2-3. He also has pinched nerves. That's why his legs are getting weak and tired. So we're going to go unpinch them. Finally, he has facet pain. He has arthritic joints full of arthritis because of trauma for years, and it's broken these joints down. So he's got pain in those 4 joints. Are you comfortable?
Are you comfy? You okay?
You having any pain? You having any pain?
Any pain?
Right now? No. Shot? How bad is that on a scale of 1 to 10? How high does it go?
10.
10. Is that where you typically get your pain?
Is that when you get your
Is that where you get your back pain?
My friend, is that where you get your pain? Yes, sir. He said.
All right, 10 out of 10, 5-1. So we just tested the L5-S1 disc. He had 10 out of 10 pain. That's horrible pain. You saw him wiggling around. I didn't tell him I was going to inject. He had no idea. We don't tell our patients. We want them to, basically experience it if it's there. But we don't want to warn them. Otherwise, they may get tense and they may get pain just from the anxiety of expecting it. How bad is that on a scale of 1 to 10?
10.
10. Is that where you get your back pain?
Yes.
All right, so 10 out of 10 at L2-3, and it's concordant. Folks, concordant just means that's where I typically get pain, right? Let's just say, for example, I don't have any pain in my leg, and then Jordan over there kicks my leg, and now I have pain. Well, I don't typically have pain in my leg, but he just created the pain. So I would say that's discordant. We don't typically have pain in the leg. He does have back pain, and we found the source. It's 10 out of 10 at 2-3, 10 out of 10 at 5-1. Are you having any pain?
How you doing, my friend?
No pain. Shot? How bad is that on a scale of 1 to 10? See him wiggling around?
10.
10. Is that where you get back pain?
Yes.
That pain will be gone when you wake up. Congratulations. Go to sleep. Have a nice dream. Count from 1 to 100 out loud in Swedish. Can you do that for me? All right. So great news. We just confirmed that his pain is indeed coming from 3 discs, and that was based on my experience of treating patients, using his MRI, and using his physical exam. I asked him where his worst pain was. It was in these 3 areas. Plus, he had facet pain. We don't need to test that. We know it's facet pain. We're going to treat that as well. This will be a long surgery. It'll take us about an hour and 15 minutes from now, so enjoy. Henry, any questions?
At this moment, no current questions.
All right, so I'm going to remove my needle. I've placed the guide wire. We're going to then use this guide wire with our dilator to spread his tissues apart. We're not cutting anything. We're not damaging anything. The only thing we've cut is the skin. Dr. B, let me know if I need a, huh? Shot? Always give the num-num. Num-num, folks, is local medication. Any questions?
No current questions, but we do have a comment from, or seeking advice from Samir on YouTube.
Samir, all right.
They,
We've talked to Samir a few times.
yes,
Come
we
on.
have. Yes, we have.
Shot.
They said, "Hi, Doc. I have pain in my shoulder. I have pain in my shoulder blades and some weakness in my right arm. I have cervical spondylosis and herniated discs. I know you can treat the disc, but what happens to the arthritic bone?"
The arthritic bone stays there. You don't need to get rid of arthritic bone. There's a lot of people misunderstanding what needs to be done to fix their spine. And the misunderstanding comes from misinformation that's out there. And unfortunately, people like Samir, because they can't get answers from their doctors, they can't get help, they start to diagnose themselves and come up with their own treatment plans. Like, how do I get rid of the arthritis? You don't need to get rid of the arthritis, okay? You need to come to Deuk Spine and get fixed. We're the only place in the world that can actually fix your problem properly. How do I know? Because I've seen patients treated at the top institutions in the world and they come out in pain. Whether it's the Mayo Clinic, whether it's the Cleveland Clinic, it doesn't matter. All the top centers that do spine surgery have horrible results compared to ours. And they do highly invasive surgery that you don't want. So what you need to do is say, where can I get my best result? Where is the safest surgery? Where is the place I go to get the best result? That's us. Nobody else. Nobody has our record. I'm just speaking factually here. All right. So one of the things that people don't understand, they think that the structural abnormalities of the spine need to be fixed. They don't understand that pain is not a structural problem. It's what we call a physiological problem. And the physiological problem is the inflammation. That's why anti-inflammatories help. That's why steroids take the pain away. Do you think the steroids you take when the injections are fixing your structures, fixing your arthritis? Of course they're not. So how are they getting rid of your pain if they're not fixing the arthritis? That's obviously because the arthritis doesn't need to be fixed. The inflammation needs to be fixed, but not the actual structural abnormalities. We don't do cosmetic spine surgery at Deuk Spine. Actually, we will do. We're going to charge you 4 times as much because of your stupidity. If you watch my videos and you learn from me and you still want your spine to look normal, just let me know and I will go in there and I will do a fusion for you. And it won't look normal, but maybe it'll make you happy. But we do charge a lot extra for fusions. Okay? Don't be a victim of misinformation. Be knowledgeable. We are the top spine center in the world for degenerative problems. We're able to fix things nobody else can in terms of pain and dysfunction. But we don't have to go in and structurally fix everything. That's not the goal of spine surgery.
You shouldn't be inclined to take your MRI to the beach.
Right. Your MRI doesn't wear a bikini.
That's a good one, right?
I like that, huh? Doesn't wear a bikini. Your MRI is not a supermodel. Doesn't need to impress anybody. All right. Any other questions?
No current questions, but we do have a comment from Samir, once more on YouTube,
Sure.
saying, "You are the best in the world. People don't understand that. Thanks for spreading the word through your videos and testimonials."
Thank you, Samir. You are welcome. Just remember, Samir, we're not going to fix your arthritis. We're going to fix the inflammation from the arthritis. That's where the pain comes from. And I wasn't taught that. I had to figure that out. Okay? I figured it out because I started doing these exact surgeries and I wasn't getting rid of the arthritis, but the patients would come back and see me after surgery and they say, my pain is gone. Okay? And of course, we watched them and said, okay, well, let's wait. Let's wait a few months. Let's see if the pain is still gone. And guess what? The pain was still gone. And we watched them for a few years to see if the pain was still gone, and the pain is still gone. So we realized that what we were doing was fixing their pain by removing the source of inflammation. But we were not getting rid of all the arthritic things, the bone spurs and the enlarged hypertrophied capsules and the modic changes. None of those were being touched at all. I mean, we were just strategically going in and fixing the actual source. So I can't say that I thought this surgery up. We did the surgery and it just happened to work. And we made observations about it working, and then I started asking, why is it working? And that's when I understood. So it was actually the result that drove my understanding of the disease. It wasn't that I knew something everybody else didn't know. I wasn't gifted like that. I've just made an observation based on the results of a new technique that nobody had ever done before, and it just happened to work. And my other technique worked too. My fusions work. I can get rid of your back pain with my fusions. But it's much bloodier, more scar tissue, more damage to the soft tissues, permanent damage, your muscles, scar tissue from the surgery. You're removing the bones and ligaments that are needed. All of that surgery, invasive surgery, gives the same result as the laser. So why do the invasive surgery when the laser has the same outcome in terms of pain relief in the back and the leg, right? You want something that's safer and less invasive. That's the laser surgery. I didn't dream it up. I just did it because some people didn't want fusion. They wanted something less invasive. And I did it to fix leg pain. And lo and behold, the back pain went away. And I was shocked and surprised at the result myself. I didn't expect it. But it was consistent. And when I started to try to understand why I was getting that good result every time, the only thing that was common was this surgery. Every step I take in this surgery was the only thing I did every time. So it had to be what I was doing. And I wasn't getting rid of the arthritis. I wasn't getting rid of the bone spurs or the modic changes or the synovial capsule thickening. All I was doing was lasering the annular tear and removing the herniation from it. And I've gone out and I've tried to teach other surgeons to do the same thing, but they don't listen. They don't want to do this surgery because it's expensive for them to buy all the equipment and train, to take time away from their busy schedules to come learn from me. They don't want to come spend a year, stop making money for a year. They won't do it. They just want to keep doing fusions on their patients, which I think is unethical. But I can't fix them. I've tried. They don't listen. So we're just going to keep doing what we know is right for the patients. All right, just about done. Let me try to grab some more of that out. Any more questions?
Yes, we have a couple more questions. This next one comes from Big John on YouTube.
Big John.
And they said, good morning. I have a post-surgery restriction question.
Sure.
When can cervical DLDR patients start to do some outside light yard work, like spring raking, etc.? Is it 12 weeks, 26 weeks, or 52 weeks?
I would say they can start doing some light yard work at 6 weeks post-op. I mean, we're talking about raking and maybe picking up leaves, 6 weeks. But no heavy, you can do some mulching, but I don't want that person, whoever it is, to lift anything heavy. So still the lifting restriction of 40 pounds after 6 weeks, but they can do some yard work for sure. No problem. As a matter of fact, I think it's good for them because it's going to improve the motion, the movement of the neck, and get back that range of motion they're missing for all that years. Great question, by the way. Thank you for asking. All right, we're done here. That was the 5-1 on the right, all finished. There's nothing left to take out that needs to come out. Now, if you go and get an MRI of this 5-1, it's going to look about the same. Okay, because remember, our view is 5 millimeter view. So we're not really making big changes that are seen on MRIs. And that's something a lot of people don't understand. This surgery is not about making your MRI look normal. It's about getting rid of your symptoms. I mean, which would you rather have? Would you rather get rid of your neck pain, back pain, arm pain, leg pain? Or would you rather keep your back pain and have your MRI look different with a cage or a fusion? I know what I would want. Common sense dictates you're going to want symptom relief. You want to feel normal. That's what I would want. That's what most of our patients want. So, but the problem is we're working in a very small zone. And remember, if you go back and look at it, you'll actually see that the fiber is 1 millimeter. So think about that. The MRI cannot see 1 millimeter. The MRI can see 3 to 5 millimeters, depending on the setting. So the changes that we're having that are being made in the disc with this surgery are so small. They're physiological changes. They're not really structural changes. Alrighty, let's put the next. Let's fix the next one. Any more questions?
Yes, this next question comes from Canes25 on YouTube,
Hello, Canes25.
asking why don't a lot of neurosurgeons understand facet pain? Why do they always think it's just your discs? It makes room for a lot of mistakes and disasters. Facets can
Sean?
cause some debilitating pain.
Yeah, it's a great question, Canes25, and the answer is quite simple. We are not trained on facets, period. We are not trained to deal with facets. We're not trained to manage facet problems. We're not trained to do anything with facets. Facets are the realm of the pain management doctor and the chiropractor. Sean? Not the neurosurgeon. Neurosurgeons don't treat facet disease. The only reason I'm treating it is because my sister, a chiropractor, and Dr. Patel, my partner, taught me that the facets can hurt. And since I've dedicated my career to getting rid of people's pain, I have forced to deal with facets because they are a significant cause of pain. So I can't ignore them. And it turns out that the pain management doctors that treat facets, they don't have a tool available to actually cure that pain. So for the first 15 years at Deuk Spine, Dr. Patel, my pain management doctor, he did the medial branch blocks, the RFAs, but the patients kept coming back. And I would look at the patients, they'd come see me, he'd send them for a consultation for fusion. And I would look at their, what we call the yellow sheet, which is their log of pain management procedures. And they would have 2 pages of facet treatments. And they would get the same joints treated over and over again. And I asked Dr. Patel, why do you have to keep treating these things over and over again? Why doesn't the radiofrequency ablation work? And his answer was, they just don't, you know? Which to me, I'm not that kind of person who just accepts that as an answer. So I started to think, well, you know, I'm near the facets when I do my fusion surgeries, and my patients don't ever have facet pain. What am I doing? And I realized what I was doing was a type of rhizotomy during my procedure, you know? And that's when I started to explore the option of actually treating facets with a permanent treatment, the Deuk plasma rhizotomy. And now that's what we're doing. we actually developed a permanent treatment. I patented it. We received our patent from the government 2 weeks ago. And I'm still waiting for the actual certificate, but my patent attorney told me the patent was awarded. So we're just waiting for the certificate, but the point is we have a patent on the technology. So if you want your facets fixed permanently, rather than going for RFAs, you come here. Now, I'm going to say something. I mean, why should I have been the one to figure that out, right? I already figured out the disc problem and how to fix it. Why should I have figured out the facet? To me, it's pretty, I'm not going to say it, but somebody else could have figured it out, right? So then I started realizing how much money is actually being made by the pain management doctors, and more importantly, the companies that make the probes. They're making billions of dollars a year, you know, on selling these items that are used every time the patient comes in for an RFA. Okay? So basically, they don't want the patients to be cured. They want them coming back. And that goes against my philosophy of being a doctor. I don't treat people with a treatment that is temporary when there could be a permanent treatment. By the way, this herniation is huge, and I'm trying to grab it. You see me grabbing it with the scope, and it just won't come out of the tube. It's too big. So I'm pulling it in pieces. All right? It's right here. I think, oh, here, no, nope. I think we got a better, no, we didn't get it. So I've been trying to grab it, but it's just stuck, and I'm just going to keep taking pieces out. It's huge. One of these times I'm going to get it. Nope. It's just breaking apart. Remember, the inside of the tube is 5.5 millimeters. So I've got to get the herniation to fit through the tube. So I got to pull it in pieces until it's good and ready to come out, which it will be soon. Any other questions?
Yes, this next question comes from Royal ViewTube on YouTube,
Nice. Hello, Royal of YouTube.
asking, "Hey Doc, if there's a herniation in the lower back and the lower back becomes unstable, can that cause a thoracic or cervical problems?"
I might have gotten it. Oh, there it is. Look at this, Henry. Oh, we got it. Holy moly. Even after pulling it apart.
There we go.
Can you see this?
Yes, we can.
Man, that's big. This is, yeah, APGAR score. This is not the biggest. All right, we have another patient who has that, a female, about a month and a half ago. But look at the size of that herniation, folks. Now, look at my grabber, okay? This is the grabber that fits in there. It's only, you know, it's not big. But look at the size of this herniation. Holy moly. Poor guy, you know, that was pushing on his nerve. And guess what? It's hard. It's hard as a rock. Not a rock, but it's pretty damn close. We call that collagenized, all the scar tissue. Pretty damn cool. Anyway, that's just one of many herniations. Let's take a look. Looks good now. I don't see any more herniation. But now I got to clean the annular tear. This was right 3-4? Yeah, right 3-4. That was a foraminal herniation at right 3-4. Big one. All right, did I answer the last question all the way? I don't know. The last person, Royal, YouTube. Did I get all their answer in? I can't remember. If not, I could repeat the question for me, Henry. Henry, are you there?
Yes, yes, sir. Sorry, I was getting an update from Sanjay with Tambeen. So.
Yeah, I mean, Sanjay needs to get this stuff done. He's got to stop putting it off. Okay?
No, he's right on top of it. Yeah, he
I
mentioned.
want it done today.
Of course. He's right on top of it.
Go
No
ahead.
problem. There are, at this moment, no current questions, so we just do have a lot of comments from Big John and Kane 25 just supporting each other from one another. I'm not going to disclose anything, but there's just a lot of support in the chat.
A lot of love. Good. Well, the reason we broadcast our surgeries live is so that people can ask questions and learn. You know, to be honest with you, I have been doing these surgeries now for almost 18 years, and I've gotten to where I can actually answer questions during the surgery, so I can teach. And I like teaching. I like people learning. And I like to be part of that. So feel free to ask questions if you have them. So I'm wiggling my tube backwards. Look at that inflammatory tissue. You guys see that? That is where the back pain comes from, right there. See the pink color?
Yes, we do.
This should not be here. It should be white, not pink. And it's that pinkness that is the inflammation within the tear that causes the back pain. 87% of people with chronic back pain have this. 87%. So if somebody is walking on the street and they have back pain, and you say, hey, you got back pain, there's an 87% chance it's coming from at least one disc injury, a tear in the wall. It's called an annular tear and a herniation. Look at that. Look how pink it is. This was a bad one. Remember, this disc was 10 out of 10 pain for his back. 10 out of 10. We asked him. We tested it with a discogram. So my goal is to get rid of all this pink stuff, as well as the source, which is the herniation, and clean up the tear so that it's going to heal. As soon as I do this, the pain will be gone. So it's probably already gone from this disc, but I'm going to keep going until it's completely clean. Now you can see the bleeding right there, a little bit of oozing. That's from inflammation. Okay? It's normally not there.
We have a question.
Sure.
Coming from Royal ViewTube on YouTube once more. Did we answer his question from prior? He was asking if...
That's what I was asking you.
Okay,
because
I apologize.
I got
yeah.
a little distracted from the herniation. I knew Royal had a question.
Yeah, I apologize. Sanjay came in when that happened. So he said, "Hey doc, if there is a herniated disc in the lower back and the lower back becomes unstable,
Right.
can that cause a thoracic or cervical problem?"
No. No, it cannot. If you have a herniated disc in your lumbar, it will not cause a thoracic or cervical problem. Now, it's common for people with lumbar herniations that are symptomatic to also have thoracic and cervical herniations, particularly cervical. As a matter of fact, the number is 2/3. 2/3 of patients with a cervical or lumbar herniation will have the other herniation as well. 2/3. So it's common for patients with a lumbar herniated disc that's symptomatic to also have a cervical herniated disc that's symptomatic. Okay? Very common. All right. Looking good. All done. Let's irrigate. Scope off. So we're finished with 2 out of 5 areas to fix. There's 3 discs with 5 areas. So 2 of the discs are bilateral. We're going to do both sides because he had leg symptoms on both sides. And I could see the nerves being pinched on both sides at L5-S1 and L3-4. I talked to my son last night, who is going to be becoming a doctor, thank God, and someday doing surgery at Deuk Spine, and someday running Deuk Spine, my son and daughter, okay? I talked to my son, he's at Princeton. He just finished chemistry. And I said, how'd it go, his chemistry test? And he said, midterms, because he's out next week for spring break. And he said it was light. I said, what does light mean? You know, I've never heard that term before. He said easy. Like, fuck. He left the test an hour early because it was done. I said, did you double check your answers? You know, I teach my kids to double check. And he said, I didn't just double check, I quadruple checked. I mean, who the hell thinks Princeton is easy, right? What kind of person? People think I'm smart as a neurosurgeon, which I am, but it's not even close to being as intelligent as some other people out there. My wife says he gets it from her. I'd be inclined to believe that. I was never a quick learner. My daughter has my learning, which is slow. I'm a slow learner. We need to put an incision. So let's do some num-num. So we're going to make another incision, okay? This is for the L2-3 on the right. I need a little bit of light here. Okay, that should be good. Here you go. Now, one thing I'll tell you about these surgeries that people need to know is there's not a lot of pain after surgery because we're not traumatizing anything in the body. That's why people don't need narcotic painkillers after this procedure. However, there is some exceptions. One of them is when you get a little bit of bleeding in the muscles, okay? Because we have to pass through the muscle. So we pass through the skin, right? We make a cut in the skin, and we pass through the fat, which doesn't hurt. We pass through the fascia, which doesn't really hurt, even though the fascia has innervation. But then you get to the muscles, and the muscles hurt. They can hurt, but we use the dilator and we spread the muscle fibers. Okay, muscles have fibers, F-I-B-E-R-S. Look them up. They're long strands of myosin and actin, and their basically job is to contract and allow you to move your bones across joints, right? Let's see what we got here. All right, so we are at that's 5-1. That's 5, 4, 3, 2, 2, 3 on the right side. Everybody agrees? Take. So muscle fibers are just that, like the fibers of a cloth, okay? And we spread them with this surgery. We don't cut them. All the invasive surgeries like microdiscectomy, laminectomy, you're cutting muscles. Henry, do you have a video that could show the audience how laminectomy cuts muscles?
I have, what is microdiscectomy?
You have the animation microdiscectomy.
Yes, I have.
But
yes.
what about those nice videos we put on our playlist? Laminectomy. Remember?
Yes.
Spent a lot of time.
Oh, yes. And then I know what you're talking about. I don't have them necessarily.
All right, why don't you move them over so we can show them in the future?
Not a problem.
So people will understand the difference between this surgery shot and a laminectomy that cuts muscle.
Copy that.
Okay?
Let's do that. Not a problem.
Anyway, we don't cut muscle, but we do go through it, and sometimes there's some bleeding in the muscle from the procedure. And that bleeding in the muscle is what takes a long time for that to heal, because your body has to break down the blood. And it will break down the blood. But while it's breaking it down and removing it, it's basically a bruise in the muscle. It's like having a bruise, playing a football game and getting hit in the leg on the muscle, and then you got a Charlie horse or a bruise. That's what it is. So we give the patient, some patients have a bruise in their muscle from the surgery, and it will go away and go back to normal, but it takes time. And that's about 10% of our patients will have some bleeding, and they call me and they say, oh, my pain isn't completely gone, and I say, just give it time. It's some bleeding. And with time it goes away. Usually a couple of weeks, sometimes a couple of months. Everybody's different. But that is one thing, and that's true of all surgery, by the way. It's not just unique to ours, but we do have a little bit of bleeding that happens, usually very little, like a nosebleed amount during the surgery. But if the bleeding is in the muscle, patients will get irritation of the muscle. And what irritates the patient is, it causes inflammation, is the hemosiderin, which is a breakdown product of red blood cells. We all know that red blood cells contain heme groups, right? Which is your iron binding proteins. And hemosiderin is a breakdown metabolic product. All right, there's a piece of herniation. Not as big as the earlier one. No, we don't need we're not going to stop the show and look at it. But we already got a good view of what a herniation looks like. A big one, okay? Earlier on the other disc. Any questions, Henry?
Yes, we have 2 questions. This next one comes from Rich on YouTube.
Rich, I hope you are.
They asked, Dr. Deuk, can I forward you my thoracic and cervical MRIs for review?
Yes, you can, absolutely. Forward your MRIs for review. You have to use our form. We only do MRI reviews in one way, and there's a process. We need everybody to use the same process. There's a form you have to fill out on our website. It's called the MRI review form. And at the end, you're going to be asked to either mail us by FedEx or UPS a copy of your MRI scan, the actual images, not the actual report. We need the report too, but you can usually upload that on the website right away. And we need the report and we need the actual pictures. So I will take those pictures. I will look at them. I will do a Zoom meeting with you for free, by the way. We don't charge for any of this. And at the end of that meeting, I can usually tell you where your pain's coming from and how to get rid of it completely. And so that's what we like to do. We like to offer that as a free service to people. Of course, it's a quick meeting. We don't have a lot of time because we have a lot of patients to get through that want this free service. So we do this several times a week, usually on Wednesday and Friday. And at the end of the MRI review, you'll have answers, what's causing your pain and how to get rid of it, the best way to get rid of it. And of course, you can ask questions. I'll answer some questions. You know, what do you think about fusion? Is fusion going to work? Is fusion better? No. Fusion's never better. But I can answer questions for you. Now, the reason we do these live streams is so I can answer the questions for you right here on the live stream. Because the truth is, those video conferences I do with you for 10 minutes, it's not a lot of time. And we spend most of that time looking at the MRI and pointing out the problem areas and what we can do to fix it. But if you have questions, this is a great place to ask questions because I've got hours, you know, to answer them. You know, Henry, I think
Yes, sir.
that's something we should do is tell Sam she's supposed to be adding in the new animations, right? Talk to Sanjay as well.
Okay.
I want the new animations on the email that is sent to the patient that fill out the MRI review form. Or will you make a note of this and talk to Sam?
Yep.
So I asked last week that we add the new animations to that email. But I also want her to put a little line in there that says, you may join us on our live, you know, spine surgery broadcast weekly, where Dr. Deuk Majin can answer your questions, and put a link on the email to our live stream. So the
Copy that.
live stream, so that if they have questions, they can come and ask me, you know, and get them answered. Because I have a lot of time while I'm doing these surgeries just to answer questions, and I'm happy to do it. You know, this I hate to say it, but these surgeries are not that. You know, once you get in and start doing it, it's not really rocket science. So It's not brain surgery. Right, Luis? Not brain surgery. Any other questions from our audience?
Yes, this next question comes from Royal ViewTube on YouTube,
Uh-huh.
asking, "Hey Doc, did the government finally accept this procedure as a standard procedure?"
Yeah, so the government doesn't accept any procedures as standard procedures. Government has nothing to do with standardizing procedures. It's not a government issue. Standardization has to do with just is an accepted procedure. And the best indication is something called peer review and publication in a peer-reviewed journal. And the answer is yes, we already have this procedure peer-reviewed and published. And the government, the only thing the government does is they'll do what's called the FDA review of a device or a drug used in a procedure. And this surgery uses government-approved devices and drugs. So everything we use in this procedure is approved by our government, the FDA. So this surgery has always been FDA approved for 18 years that we've been doing it almost, and it has been peer-reviewed and published as safe and effective for the treatment of disc problems for now 12 years. So, our surgery center is reviewed by the government every 3 years by Medicare, and we have always passed. Our surgeries have been reviewed, our everything, our processes, documentations, everything has been reviewed and passed. So, yeah, we've never had an issue with government review. I hope that answers your question.
We have another question.
Mm-hmm.
This comes from, forgive me if I pronounce this wrong, Bromels
You holding it?
on YouTube.
All right. Hi, nice to meet you. Welcome.
They asked, "Does all untreated hernia eventually lead to degenerative bone disease, or does it depend on the severity of the bulge?"
Hey, great question. So the question is, does all herniated discs eventually lead to degenerative disc disease, not bone disease? And the answer is yes, they do, if they're untreated. And the only treatment in the world that is designed to fix that is this surgery you're watching right now. We are literally inside the annular tear. Once I'm done with this right here, cleaning, debriding the annular tear, it's called, then the disc will heal. And the degeneration should stop because the inflammation stops. Remember, the degeneration comes from inflammation. Get rid of the inflammation, you get rid of the degeneration. Now you know the inflammation's gone when the patient pain is gone from the disc, which our patients experience at 99.6%, 99.6% elimination of disc pain with this surgery. That's based on hundreds of patients. I think 500 was the number. We looked at 500 patients with this surgery, and our average pain relief was 99.6 for the disc we're treating. Of course, if patient has another cause to their pain, like piriformis syndrome, that's not going away with this treatment. You have to treat the piriformis syndrome separately. Great question. Yeah, 2 more, and we're pretty much done with this one. I'm just wrapping it up. Let me see if that's a piece of herniation I can get out. Keep the questions coming. I'm happy to answer them for all you folks.
This comes from Canes25 on YouTube.
Hello, Kane25. Welcome.
saying, I just saw an article about many people getting letters from their doctors telling them they can no longer service them because they are dropping their insurance because they don't pay. Many doctors are opting out of
Yeah.
major health insurance carriers because they can no longer,
You're right.
for less than what I understand. Can you imagine the anxiety and stress that has placed on these people? And I heard it's from hundreds of thousands of people.
Keynes 25, you have hit the nail on the head. This is what I've been telling people for years. These insurance companies are stealing you guys blind. And they're stealing me blind because I pay for insurance too. I mean, I had United Healthcare, and I had to have sinus surgery, and they refused to pay for my surgery, even though I couldn't breathe at all. And I did all the tests. I did the studies at night, you know, that sleep study, and I stopped breathing. I mean, my surgeon said, you have a horrible case. And United Healthcare refused. They rejected my prior authorization. I paid out of pocket for my surgery. So yeah, it's horrible. And people need to become aware of it. We need to spread the word. These insurance companies keep raising their premium every year. And our country is spending $3.5 trillion a year, with 20% of our gross domestic product, our national budget, GDP, is spent on 20% is spent on healthcare. And the insurance companies are trying to make it sound like the doctors are getting all the money. We're not. We're getting grossly underpaid. When I was doing fusions and I was getting authorizations, I was getting paid, I saw my income drop by 25% in 5 years doing fusions, okay? So what I'm saying is they're doing it to everybody, and it's across the board, and they're keeping all the money. They're making trillions of dollars in profits, and they're hiding all of it from you, the public, and from the government. And they're successful. The insurance companies are the most powerful organizations in the world, and they're basically above the law. They write the laws. They use politicians, they support them, presidents, to write laws. Look at Nikki Haley, right? I'm just going to use her as an example. I'm not going to tell you that I'm Republican or Democrat. I'm just going to say Nikki Haley was her campaign against Trump. She was talking about how we need to expand the Medicare Advantage programs to provide more health care to people. Are you kidding me? The Medicare Advantage programs are ripping off our country, our taxpayers, our government, everybody, by taking huge premiums and not paying for people's medical care. They're under fire because the Medicare Advantage programs have been not paying hospitals and doctors and just keeping all the profits and making billions of dollars in profit. So I think that the problem is our politicians are allowing the insurance companies to take advantage of our regular everyday citizens and not pay their medical bills and get away with it. And the only way they do that is by calling it experimental. That's the same thing they say, unnecessary and experimental, okay? There's nothing experimental about this surgery. We have proven it over and over again. For 18 years, we've done 2,000 of these surgeries, and we have a 99.6% shot elimination of pain. That is not experimental. 99.6 rounds up to 100%, okay? And you can't call that experimental, folks. But that's the only way they can get away with not paying it. So we're challenging them. I've just heard from my attorneys in New York, and they are going to take on the first insurance company. I'll leave it as a surprise who it's going to be. And they're going to file a lawsuit to get them to pay for this surgery every single time, so that patients don't have to pay out of pocket more than they normally would, okay? And that's great news. So we're getting ready to go to war for you, the patients. Shot. We're going to fight the insurance companies to get them to do what they're supposed to do, which is pay for surgery. You know, it's disgusting when people have to dip into their retirement savings and pay out of pocket for medical care that should be covered by an insurance company. And nobody's holding the insurance companies accountable. Nobody. But we will. And I've been planning this for 15 years now, 16 years, and preparing for war with them. And it's going to be an exciting year. If we defeat, it's going to be Blue Cross Blue Shield. That's the first one. Might as well let you know. If we defeat Blue Cross Blue Shield and they have to pay for these surgeries, then it's going to open it up for everybody. People can avoid fusions. They can avoid laminectomies and invasive discectomies that are horrible procedures. Wait. All right. Yeah, it's fine. Just kidding. Anyway, I'm excited about it. You know, it's something that I'm looking forward to. There's nothing I hate more than people who need our care and can't get it because they can't afford it, because their insurance won't pay for it. And the insurance companies won't even listen. They don't care. I have a guy who has been working on trying to contract and get this covered. I've had several. I even hired a politician years ago to do it, and he was unsuccessful. They just told him to basically fuck off. We're not interested in adding more surgery.
Yep.
Yeah, pull the center back a little bit. Yeah, that's good. So, anyway, I'm going into L5-S1, and shot. It looks good. Yeah, that's good. We're good. Take it out. We're going to do L5-S1, shot, left approach. Sorry, yeah, left approach. And then we got one more, which is going to be the L3-4 left approach, Deuk laser disc repair, and then we're going to do the facets. And I'm going to tell you something, folks. If the insurance companies actually did what was right and they paid for these surgeries every single time, then people could get it done and they wouldn't have back pain anymore or neck pain. And it would save the insurance companies billions of dollars in fusions and procedures that don't work, you know, and that have high complication rates. Let's face it, fusion complication rates are very high, up to 50%. It's published in the literature. So when you have a complication as a patient, it ruins your life because it's a permanent thing. Complications are never just temporary. Whatever complication it is, I guarantee you, it's going to be permanent. Okay, if you have an infection, you're going to have permanent damage from the infection. If you have, you know, ligaments and bones removed and destabilizing your spine during the surgery, you're going to have permanent. Everything is permanent, okay, with these invasive surgeries. So why not pay for something that is far less invasive, no complications, safe, back to work quickly so you can get your employer happy and paying your premiums? I mean, it's just makes sense. So it's the only reason the insurance companies don't like this procedure is because everybody's going to want it, and they're going to have to pay for it, and they don't want to increase access to care. So the only way to get an insurance company to behave and pay for things that are medically necessary is to take them to court and fight them. Today, that's the only way they do it. There's no panel, there's no governmental action, there's no presidential decree, there's nothing. It's literally, they have written the laws of this country, federal and state laws, that allow them to deny payment. But they do have to follow some laws that are out there that were, you know, put in years ago that they haven't been able to overturn yet. And that's what we're going to use. We're going to use those laws to fight them. For you guys. Not for me, for you. So it's taken a lot of my time and money and effort to get us here. Millions of dollars that I got from patients for their surgeries I've spent on this lawsuit, getting it ready to take the insurance companies to trial so that they'll have to pay for your surgeries every single time. Right now they pay maybe 20%, but we need them to pay 100%. And the only way we can do that is to have them contracted to do that, which we don't have them contracted to do that. So I hope that answers the question, but I gave you a long answer. And we'll see. We'll see what this year brings in terms of a verdict. If it comes this year, if it next year, it may take a few years. A lot of times these types of lawsuits take years. So good news is we have a great partners, great team of people fighting on your behalf, and of course the patients fighting. They need to fight. This is time to put on the boxing gloves.
No current questions, but we do have a comment from Kelly on YouTube.
Kelly on YouTube, welcome.
They said, my great surgery denied me. They have a third-party panel making our medical choices on who we can see. Funny, my third party said that Dr. Deuk's laser spine is not a standard of care. They said this is because there is no evidence that this procedure is equivalent to or superior to traditional spine surgery. They make me sick. They are in the buzz of making a lot of money.
Yeah, that independent review that you had done is not so independent. They call it an independent review, okay? But that's like me, I always make the analogy to things that are happening badly to people, because I try to create things that draw on our history and our past as a world, as a nation, that we can learn from. Hopefully we learned our lessons, from bad things, right? So I'll give you an example. We used to have slavery, and to justify it, we used to say that the people that were slaves were not humans. They were subhumans, and they were considered not human. They were considered like somewhere like close to primates, okay? That's what the people that condoned and supported slavery in this country and others believe. They believe that, white people were superior, and that we were built superior and better, but in reality they were saying that those slaves were not real people. They weren't humans, okay? That was ridiculous, right? We all know, you and I know that's a ridiculous thing to say. It's totally absurd. But that's what they did back then. So the wealthy slave owners would hire these scientists that would go look inside the skull of, say, African Americans, and they would do something called phrenology, where they would say, oh yeah, these people, these African Americans, they're not real humans, they're subhumans, and therefore we can have slaves. Well, I'm sorry, but that's bullshit, and that scientific evidence was complete bullshit, but they said it publicly so the public would be supportive. Well, that's exactly what these insurance companies are doing, the same thing. They're saying that they're getting an independent panel of scientists who are evaluating a treatment that works, of course, we all know that, and they're saying it doesn't work, it's not the standard. It's just basically smoke and mirrors, and you're right, you should be sick. And I don't know if it's Blue Cross Blue Shield that did it for you, but if it is, make sure you give us the denial and that we include you in the lawsuit. That's what I would say. Here's your opportunity to fight back. Unfortunately, these lawsuits cost like $10 million, and you don't have to pay, thank God. I'm putting it all together for you. I'm not paying $10 million myself. I don't have it. But the lawyers are willing to do it as long as the patients are willing to fight. And the outcome we're looking for, I don't care about the money. I care about getting it so the insurance companies cover it for everybody. So they can't make this bullshit excuses up or use these panels. Okay? Anyway, I'm sorry that they're doing that to you. You're not the first person. They do it all the time. And they're hoping that you will believe them, just like people believe that slaves were subhumans because they studied their skulls and said they didn't have as big of a skull and didn't have the same brain areas that the slave owners had. It was all bullshit. But they tried to make it scientific, and it wasn't. And now we know better. It was just a scam, so they could do bad things to people. And that's exactly what the insurance companies are doing. They're doing bad things to their beneficiaries by denying treatments that work. This is not the first time. They do it all the time, and it's not just for spine. They do it for all kinds of stuff. They even deny cancer treatment, to people. And I posted an article where a lawyer who needed cancer treatment, proton beam treatment, Blue Cross Blue Shield denied it, saying it was never proven to be better. But it was better, and that's why his doctor recommended it. And he paid for it $100,000 out of his pocket, $115,000. And then he fought Blue Cross Blue Shield for 3 or 4 years and eventually won in court. And they proved that it was definitely better. So that's what we are going to try to do, okay? No guarantees we're going to get it done, but we're going to do our damn best. And we need patient support, people like you joining us to fight, because insurance companies are evil. They only care about just keeping the money and being profitable. They don't want to help people. That's the God's honest truth. That's my opinion. All right, we're just about done with 5-1 on the left. Then we have one more on the left, which is the L3-4. And so far, he's doing fantastic, right, Dr. B? Yeah, he's snoozing and cruising and happy. And we're going to be done in about 20 minutes. So I'm going to finish the last disc, which will take another 10 minutes. And then I'm going to do his facet joints on both sides. And we should be able to find the nerve root right over here. Okay? This is going to be your left L5 nerve root. And it's in that fat right there. So I can't really see it, but we're pretty much done. Just going to zap this last piece of disc herniation away. And we're done. Good job. One more disc to go and we're finished. Thanks for posting your experience. I'm sorry that that is happening to you, but it is common. And we're hoping to change that. We'll see. Maybe we won't. Maybe we will. I'm certainly going to give it my best effort. All right. Good job, Luis. Thanks for... One more to go. It's kind of stuck in there because the bones at 5-1 are so collapsed from the degenerative disc disease that it's squeezing on my tube, keeping my tube from coming out. Put pressure. All right, last one. We're going to do 3-4 on the left. We're putting the guide wire through the needle that's already in the disc, and we're going to get an x-ray, and it's going to guide me. Take a look at this incision. It's only probably about 8 millimeters. Can you guys see the incision here, Henry?
Yes, we can.
So just to give you an idea, it's a pretty small incision. All right, is that it? Good. Let's move these cables. And any questions? Shot? All right. Let's just show sacrum a little bit so we confirm we're in the right spot. Shot? All right, so there's 5-4-3, 3-4, 5-4-3, 3-4. Everybody agree? Thank you. Shot?
No current questions, but we do have a comment from
Shot?
Kelly on YouTube.
Yeah, sure.
They said, well, it's kind of a question. Kelly said, who the hell is that panel to make my medical decisions? I am a workman comp case, waiting for my approval. I will be seeing you, Dr. Deuk. I have PPO, Blue Cross, Blue Shield.
Yeah.
They are full of crap, but
Yeah,
it's
you're
not crap.
right. Kelly, I couldn't agree 100% more. You are 100% right. Why should a panel that is controlled by the insurance company, and they think people are stupid. Oh, we have a panel of experts. No, it's a panel that you picked, that you pay, and the panel knows what the decision is supposed to be before they make it. And if they don't make the right decision for Blue Cross, they won't be added to the panel next time and they won't get the money. It's basically Blue Cross and other insurances use these fake panels, and work comp does the same thing. Insurance companies use these fake panels, these fake peer review that is not really a valid process. It's contrived, and it's designed to make people, patients, believe that they're going through an appropriate process of validation of a technique or treatment or diagnostic test or whatever. But in reality, it's not. And you see, the thing is, they're going to pay those panel members probably $1,000 a piece to review your case, spend 10 minutes to say no. And that's $1,000 for 10 minutes of work. I mean, I'm just picking a number. That's probably what it is, around $1,000 plus or minus. Yeah, we get invited to these panels all the time. I get offered to be on these panels by the insurance companies. They say, do you want to be on this panel, basically to deny patients treatment? We'll pay you $1,000 an hour. And all you got to do is review the records and give us your opinion that they, whatever your opinion is. And I never do it because I know exactly what it means. They want me to say that patients don't need the treatment so they can save $100,000 not treating them. And it's totally unethical, and I won't do it because that's not why I went into medicine. I went into medicine to help people, not hurt people or be part of that hurting. So I hate them, and they're sneaky bastards, and they think people are stupid and won't figure it out, and I'm here to make sure you guys do figure it out. That's why we have our broadcast. I wouldn't be saying it if it isn't true. Trust me, I've seen it hundreds and hundreds and hundreds of times. And the system is working against you folks. It worked against me when I needed surgery, and it's working against you. And we have to fix it. There's no sense in going on like this, because you guys shouldn't be paying hundreds of dollars a month for health insurance that doesn't cover anything that you really need. The whole purpose of insurance, for those of you who don't know this, the whole reason insurance came into being was to do something called, here's the magic, spreading risk. Spreading risk. What it means is that, pooling risk, spreading risk, they take, 100 people and you all kick in a little bit of money, and the chances are that, maybe one of you needs medical care. Out of that 100, well, the other 99 are paying for that one's medical care that the one couldn't afford. That's what insurance is supposed to do. It's supposed to pay for the treatments and tests that are needed, recommended by the doctor, that are reasonable, and spread that payment over a large group of people. Well, the concept of insurance is wonderful. It's supposed to work that way. But what the insurance companies have learned over the years of doing this is that they can deny treatments and save money and make more profits by doing that. So that's what they do. And there's no regulation. That's what they've learned. Nobody's going to regulate us. Nobody's going to stop us. No one to stop us. Right? Like if you go to the store and you want to steal, the security will stop you. The police will stop you. I mean, somebody's going to stop you. Maybe you'll stop yourself if you're brought up properly, or your parents will stop you, your friends will stop you, somebody will stop you. The system has lots of stoppers. But when it comes to insurance company, there's nobody to stop the insurance companies from being bad. Nobody. And they've designed the system that way. That's the system they operate in. The only person that can stop the insurance companies is the state insurance regulator, or the citizens of this country, of the state, or of the country. So insurance is regulated on a state-by-state basis. And in Florida, the insurance regulator commissioner is basically put in their position by the insurance companies. So they're very favorable and supportive of the insurance companies. So the person that you guys have in position in Florida that's supposed to be helping patients get insurance care they need, that person is basically bought off by the insurance industry and put in that position by the insurance industry. You understand? And they're friendly to the insurance industry. In California, maybe the one thing California's got right is the insurance commissioner hates the insurance companies because they realize they're greedy pigs and they're screwing people. And they actually are fighting the insurance companies and fining them millions of dollars in fees on a regular basis. Now, you may say good for California, but if the insurance commissioner of California fines Blue Cross Blue Shield $2 million for false advertising of doctors in its network, and they really should have fined Blue Cross $10 million, then whose side are they really on, right? Are they on the people's side, or which they should be, or are they on the insurance company's side? Do you understand what I'm saying? As an example, if the insurance commissioner doesn't properly punish the insurance company, then the insurance company, for bad behavior, then the insurance company is just going to keep doing their bad behavior, right? We all know that. Right, Nikki? I'm big on punishment. I'm very big on punishment. I really am. I mean, rewards are important too, but punishment is necessary. And the insurance companies need to be punished. Trust me, they need it. Because they've gotten away with horrible, horrible crimes against people. Like not paying for cancer treatments, letting people die of cancer. Look, if you die of cancer, you're not just dying, okay? You're suffering, then you're dying. And that's not right. People with chronic back pain, they're suffering every day. They're basically being tortured by their pain every day. And the insurance companies are standing around allowing it to happen. So yeah, I'm not happy about it. That's why I'm so vocal about it. I want people to understand what's really happening. The insurance companies have been very good at divide and conquer. They divided you guys so you can't go together and help work together, and they're conquering you. Okay? Same thing with doctors. They've divided doctors and they're conquering them. By the way, you guys know that 10% of all doctors in the United States now work for United Healthcare? It's called United Healthcare Optum. They're buying hospitals, they're buying doctors, they're buying everything in medicine. They bought the anesthesiologist. And what they're doing is they're buying all these doctors up, and then they're going to tell them, hey, if you see a patient with back pain, you tell them to go smoke marijuana. So that, number one, we're not paying anything for their medicines or treatment. Number two, the marijuana is coming out of their pocket. And number three, we're going to become more profitable. So you get rewarded for telling them to go smoke marijuana. That's what's happening, folks. Right under your noses. I'm seeing it. I'm telling you, it's crazy. The legalization of marijuana in the United States for medical purposes coincides with the war against opioids. And all of this is driven by the insurance companies. Who else has the money to do that? To make this huge PR campaign? People have been dying of opioids since the 80s. Where was the concern then? There was none. Because the insurance companies had bigger issues they were dealing with, okay? But now that they're just tightening their death hold on all of our necks, now they're attacking opioids because they spend $3 billion a year on opioid pills, paying for people's opioids, right? And I agree, opioids should be phased out, all right? So here's one thing I agree with them, but their motivation is financial, not your well-being. And whatever. Doesn't matter what their motivation is as long as they achieve the goal, which is to get rid of opioids for chronic pain. We should be fixing chronic pain with surgeries like Deuk laser disc repair, Deuk plasma rhizotomy, not getting people addicted to drugs by putting them on opioids. So I think opioid for chronic pain needs to go away, but not for the reasons the insurance company wants to go away, because they don't want to pay the $3 billion a year. That goes to their bottom line now. They make $3 billion more profit. And that was like 10 years ago, $3 billion a year. They probably would be spending $10 billion a year. What they saw, though, was an escalation in their outlay of payments for opioids, and they realized, hey, in 10 years, we're going to be at $5 billion, $6 billion a year. If we nip it in the bud now and we make opioids bad, and everybody thinks opioids are bad and doctors are evil for prescribing them and pharmacies are evil for supplying them, then we can be saving $10 billion a year that goes to our bottom line. And you better believe some psychiatrists, some lawyers, some politicians all got greased on that one. But you guys are paying the price. Now people can't even get opioids anywhere. And you need them. Like if you've had back surgery, you need opioids. You need them. You can't do back surgery, open back surgery, invasive back surgery like fusion without them. So look what they've done. They're brilliant. These insurance companies are freaking brilliant. They've made opioids illegal to prescribe basically and supply, make it very difficult. Now, not only do they save the money on paying for the opioids at the pharmacy for the patients, their beneficiaries, but they also can't do invasive surgery because people can't get the opioids they need afterwards. They're saving not $8 billion or $10 billion a year. They're saving hundreds of billions because people can't get invasive surgery because they can't get the opioids. It's fucking a racket. And you guys are just sitting there. It's happening under your nose. I'm the only one talking about it. And more people need to be talking about it. All right. Let's get the fluoro in. Let me go to the other side because I don't like working on the fluoro side. And basically, we're done with the laser surgery, 5 disc spots fixed. You all saw that. Rewind, go back to the beginning. He had 10/10, 10 out of 10 pain. Worst pain you can have from those 3 discs. We just got rid of that pain. Now we're going to fix his facet pain. He's got 4-5, 5-1 facet pain on both sides. Needle. So hopefully you're enjoying our surgery and you're learning something. Insurance companies are the bad guys, trust me. Shot. All right, we're almost at L4 there. Right there, shot. That's perfect. If I can hit bone right there, I'll be happy. Yep, there it is. So I'm right on the bone, shot. You guys see where that tip is? That is literally the most perfect spot you could possibly be. Show him, Jordan, with the white arrow. That's right where the transverse process meets the superior facet. That's right where the pain nerve is running. It's about a millimeter wide, and it's about as wide as that fiber was for my laser. And I'm going to go in there and destroy it. Now, this is what every pain doctor wants to do with an RFA. Maybe they don't want to do this. I want to do it. They want to keep you in pain. I want to get rid of your pain because I have enough business. I don't need repeat business. I don't need people coming back over and over again. I don't want people coming back. I don't think that's right. I think doctors should fix problems and not cover them up. Shot? Especially when they're able to fix problems. So we need to fix our healthcare system so that you all can get these type of treatments that are curative rather than pain pills or shots that are not curative. Jordan, you feel we're in the right spot, right?
Yes, sir.
Yeah, I do too. It's a little catawampus, but I feel the transverse process right there. I feel like we're in the right spot. Can feel the mammillary process. Anybody know what the mammillary process is? Anybody? Bueller? Oh my God, no? Are you kidding me? What's wrong with you people? Henry?
I've never heard of that in my life.
Oh my God, Henry. You don't know who Ferris Bueller is?
I know who Ferris Bueller
Shot?
is. The question you asked before, I had no idea what it was.
The mammillary process of the transverse process. It's a little bump in the back of a little ridge that's in the back of the TP. You know, right where it joins the superior articular process. I've seen it a million times. Of course, I'm exaggerating a smidgen, but I've seen it a lot because I've done so many fusions, honestly, that it's always there. All right, I mean, I can't do better than that. I'm going to go a little more medial. I'm right on the superior articular process there, shot. See the base of the SAP? Point to right where we want to be, Jordan. Nope, a little higher, just a smidgen, right? A little bit, right? A little higher, right there. You see that little curve right there in the bone? See that little gray thing? That is the most perfect spot, shot, for this procedure. And that's exactly where the tip is. You see that? And
Yes, we
that
do.
is the ridge of the mammillary process right there. So you have to be in the right spot, and you have to do the Deuk plasma rhizotomy technique, which other pain management doctors don't do. They don't know about it. I developed it and pioneered it. My gosh, look at all that arthritis. It's an unbelievable. Shot. I've got probably 5 minutes maybe left. Shot. Trying to get to the right spot. Shot. It's a little too low. Shot. A little too low, right, Jordan? I think we need to be a little bit higher. There we go. Shot. Let's see where that is. That's almost perfect. I'm sorry if it all looks the same to you folks, but there's actually a little thing here, a little ridge. That's it. That's the perfect spot. Maybe slightly, yeah, that's as good as we're going to get it. I can feel the arthritis down here. It's massive. But anyway, I think that's probably good. I went medial to lateral. And this technique is called the Deuk plasma rhizotomy. We did patent it. And we received the patent just 2 weeks ago, 2 to 3 weeks ago now, from the United States government. And it's better than an RFA, obviously, because RFA doesn't last. Let's see if this lasts. Shot. All right, how come I don't see the TP over there? I feel bone. Is there a weird TP there? Can you rotate the fluoro slightly to give me a little better view? By the way, show us that abnormal bone right there. You guys see that huge extension of bone? That shouldn't be there. Show us. Yep, that whole thing. Circle it. Quick circle. Yep, that whole thing shouldn't be there. That is what we call DISH, diffuse idiopathic skeletal hyperostosis. Okay, now I see the TP. And there's nothing you need to do about DISH. The worst thing you could do is try to operate on it because you can't fix it and it doesn't cause symptoms. All right, we're there. Go ahead, hook me up, and let's inject. Pull back first and inject. Yeah. All right, very good. We're going to get started on the left side, and I'm going to do the same thing. I'm going to go burn 3 pain nerves on the left side, and we call that a rhizotomy. Again, the only thing that it has in common with the RFA is that you're targeting the same nerve, okay? But what we're doing here is we're actually going to destroy that nerve, not just temporarily phase it. We're going to destroy it. Shot. An RFA doesn't permanently destroy that nerve. It just, I don't even know the right word. I mean, I know the right word in medical terms. It's called a neuropraxic injury, neuropraxia. But in something I could tell you guys that you could understand, besides neuropraxia, if you look up neuropraxia, it'll explain it. But it's really more of a stunning the nerve. So RFA stuns the nerve. Deuk plasma rhizotomy destroys the pain nerve. You want it destroyed, Shot? Because destroying the pain nerve means permanent pain relief. It can never reattach and grow back. All right, any question?
Yes, we have one question. This comes from Kieran on YouTube,
Hello, Kieran.
asking,
Shot.
is there any way a surgeon could have endoscopic access to a large L5-S1 through the intervertebral space without laminotomy, considering the hernia is paracentral?
All right, read the question one more time.
Not a problem. From
Shot.
Kieran asking, is there any way a surgeon could have endoscopic access to a large L5-S1 through the intervertebral space without laminotomy, considering the hernia is paracentral?
Yeah, this surgery you're watching right now is that surgery, Kieran. This surgery is transforaminal. You have to understand something. We're going transforaminal without removing bone and ligament. There is no bone or ligament being removed. So we're going lateral transforaminal. This is the surgery you want to have done for a paracentral herniation, or you want to do. I don't know if you're a surgeon or not, but this is the surgery I'd want to have done. Shot. 30 seconds. Oh, we all did well. Yeah. Kieran, I don't know if I answered your question or not, but I think I did. Huh? Yeah, good job. No narcotics at all. Wow. We're done. Let me show you guys this. Thank you. Let me show you guys everything here. Come on down. All right, so we've peeled up things, but you guys can see we have the right L2-3 incision. It's about 7 millimeter. The right L5-1, L3-4, it's about 1 centimeter, 10 millimeters. We have the left about a centimeter. And then we got the Deuk plasma rhizotomies, which are 4 millimeters each, right and left. Done. This patient's going to go home in an hour. The alternative scope use is a 7. The alternative would have been a fusion of 4 levels with 4 cages and 10 screws, 2 rods. I mean, massive surgery, which I could have done also outpatient. Nobody else in the world can do it outpatient, but we do. And we've done it for 10 years. But why go through such a major surgery and a horrible recovery? By the way, our fusion patient from last week, remember she had the artificial disc that popped out? She stopped taking all of her narcotics and painkillers 3 days after my surgery. She went home the same day, outpatient. She stopped all of her pain meds in 3 days. That's how gentle our surgeries are, even fusions. All right, I'm going to come and answer questions, but play our animation on the Deuk plasma rhizotomy and the Deuk laser disc repair, if you have it, so that people can see it, and then I'll be there shortly. Blood loss 5 mil.
I'm here with a gentleman who came to the Deuk Spine Institute with horrible back pain, pinched nerves, symptoms down your leg, weakness, numbness, and using a walker. He's been struggling now for quite a while. You had the Deuk laser disc repair done yesterday in the morning. We went in with the laser and we cleaned out 2 discs that were really causing pain in your back. They were herniated and starting to degenerate. How do you feel today?
10,000 to 50,000% better. Absolutely wonderful. I can't even, it's hard to explain. Going from not being able to walk 5 feet to being able to almost just walk around the block. It's one day. I mean, it's 24 hours. It's incredible.
And when did you realize you had this relief on your back?
Yesterday, when I got home and got settled down, and there was no pain. There was no pain in the back. There was no pain all the way down the leg to the big toe. It was like, where'd the pain go? It just dissipated. And that's after surgery. So usually you feel like there's surgery, there's gonna be some pain. No pain. I can't even explain it.
Well, you're doing a good job. What was life like before you had the Deuk laser disc repair surgery?
I didn't want to live this way. There was no way I would never want to live that way. Never want to, no. Excruciating pain. I mean, can't sleep, awake all night. The pain was constant, it never left, but you got so exhausted from feeling the pain that you would finally fall asleep. I would finally fall asleep anywhere from an hour to 2 hours at the max, and 2 hours was a gift, and that's all night long. I had to sleep in the room by myself because I would have kept my wife awake all night. I was just miserable, the most misery I've ever felt.
I met your wife. She's a lovely lady. She's by your side all the time.
Yes, sir.
It's hard when you have so much pain. It takes a toll on you, but also your loved ones.
Yes, it does. And she's been a God's gift. I will say that.
Now, how does she feel about your surgery you had yesterday?
She's very happy for me. She's been through every day of it. And this started before Thanksgiving. And we are 3 days from Christmas. And I'm going to have Christmas without pain. Thank you, God. Thank you, doctor. Thank you, everybody in the staff. This staff is unbelievable. Nicest people I've ever met.
Well, we care about people like you. We want you out of pain and happy and getting on with your life. And tell me about your job. You have an interesting job.
I do. I love my job, and I call it the greatest part-time job in the world. One of the highlights of my job is something I can say about it is it's a job where you can say no to work and you'll have a job the next day. It's the only job in the world that I know you can do this. I'm a stagehand with the International Alliance of Theatrical Stage Employees out of New York, and I love my job. I do everything from entertainment, theaters, arenas, to trade shows.
What's the best show you did?
I've worked with 2 out of 4 Beatles. I've worked with, everybody from Kenny Rogers to Celine Dion. I've worked with Van Halen. I've worked with all big entertainment. And then I've done a lot of medical trade shows, so I know where I'm at. When I come into a medical facility, I look around and go, oh, I know where that comes from, and I know where that comes from. And it's a great job. It's a wonderful, wonderful job. I see things before normal people see things. I saw the first flat screen computer and I didn't think too much of it because I wasn't a computer person. Now it's like, look at the flat screen TVs, and it's a great job. That's the trade show side. The the side where what keeps our country moving is people buying and selling the products that we use, from the cameras that are on us right now and the lights that are on us right now to doctor's coat that he's wearing and the shirt that I'm wearing. So
And probably
it's
some of the
incredible.
equipment we used in your laser spine surgery. where we went
Absolutely. The best shows I do, I have to say, are the medical shows, because I go around and I get literature and I read and I learn from past experiences with herniations. I've had double hernia surgery, so I know about that. I've had hand surgery, I've had knee surgery, now I've had back surgery. So I learn, and it's, you get to talk to the people that do the work and represent the products, and it's pretty awesome. So I love my job. I miss it. I honestly miss it.
Well, now you're going to be able to go back to work without that pain.
Oh, thank God. Thank you. Thank you, Doc.
You're welcome. Is there anything else you want to say to your fans out there?
If you're having issues, any kind of issues with back, knees, joints, you need to come to Deuk Spine. You just have to. The Institute is wonderful. Everybody here, there is no negativity in this building whatsoever. It's unheard of out there. And I've seen a lot of doctors over the years for different reasons, but there's no negativity here. It's all positive, and you leave positive. So I'm very, very happy that I did this. And I tell anybody that has ever gone through any kind of pain, you need to come see Deuk Spine. People come from all over the world, and now I know why. I just came from up the street, so I can tell you, up the street or from another side of the country, just come to Deuk Spine. That's the best I can tell you.
Well, thank you for sharing your story. Congratulations and Happy New Year.
Happy New Year and Merry Christmas to the whole staff. All your people are excellent, to your family as well, and their families. And I hope everybody has a wonderful Christmas. And by the way, the office is magnificent. That is the best I've ever seen. That shows when you walk through this office for Christmas holiday, it's all about family. It's all about the holidays. It's about the people that come through.
Thank you.
Thank you
very much.
Okay, hopefully you enjoyed that testimonial as much as I have. We've just completed a pretty extensive surgery on a patient who travels from South Florida up here because he's had problems with his lower back pain, basically, for years, 40 years, as a matter of fact. And when I examined him, I realized his pain was coming from two distinct areas. One was the discs, and the other was the facet joints, And when you move your back, you're moving at the disc and the facet joints. There's two joints that are moving, the disc and the facet joints, all right? So I realized I had to fix his disc and his facet joints. And it was the number 233451 disc, and it was the number 4551 facet. So we went in today and we went on both sides at 34 and 51. I got the herniations out that were pinching the nerves, and I cleaned out the tears, which should get rid of the back pain and leg pain. I also fixed L2-3 on the right side because he had a pretty big herniation on the right that was pinching the nerve going down his right leg. So I expect his leg symptoms to go away. He may have some numbness that takes about a year to go away as the nerve will heal. The second thing we did was we went in and destroyed the pain nerves to the facet joint. And to do that, we went and targeted right where the transverse process meets the superior facet. There's a little bump there called the mammillary process, and I just had to burn those nerves right there, okay? It's called the Deuk plasma rhizotomy, only available here. It's a permanent fix for facet pain. Hopefully you enjoyed the surgery, and I'm here to answer your questions. And hopefully you got a chance to appreciate our new animations that I've been working on for 12 months plus, more than 12 months.
A little bit more, yeah.
Long story there, but we have a great animator now, and he's done an incredible job with the animation. So hopefully you learned something from the animations. Questions?
Question 1 comes from Kieran on YouTube.
Hello, Kieran. Kieran.
Asking, I know the DLDR is transforaminal. I want to know if it's a large hernia at L5-S1, and maybe you want to access it from behind through the intervertebral space without.
All right, I understand, Kieran. I understand. So what Kieran's asking is, Dr. Deuk, somebody has a huge herniation, paracentral L5-S1. You're coming this way. Maybe you can't get to it. First of all, I always get to it, okay? Second of all, what he's saying and now I understand intervertebral. Kieran, what you should be saying, and why I didn't understand you, you're saying the wrong thing. You need to say it's called translaminar, okay? So translaminar means you hit the lamina and then you go through the lamina. And what you have to do is you have to drill a hole here in the lamina and here in the facet. You got to remove half of the facet, you got to take the lamina out, you got to take the ligamentum flavum out. And then you are going to hit the nerve root and the thecal sac. And you got to pull those to the side. And hopefully you won't damage either of them. And if you do, you get a spinal fluid leak or nerve damage. So no, translaminar sucks. And translaminar is for inferior spine surgeons. If you want the best, you go transforaminal. And that's what we provide, transforaminal. Translaminar is for 99.9% of other surgeons who can't do transforaminal. You understand what I'm saying? So translaminar is the wrong way to go. It causes permanent damage to the patient's spine. It is a horrible surgery. That's what everybody else does except for me and a few other transforaminal surgeons. Yes, it's hard, but whoever said being a neurosurgeon was easy? Whoever said spine surgery was easy? It is hard. It's hard to do it right. So if you can't do it right, don't do it. Send them to me. Next question.
Next, last but not least, from Lanu on YouTube, asking, I assume Deuk laser disc repair surgery is not available in Japan?
Hi, Lanu. It is not available in Japan. You are correct. There's lots of things available in Japan. I love Japan. You have Mount Fuji, not available here in Florida. You have the little monkeys that sit in the hot water during the snow, and they have all the little snowflakes on them, the cute little orange faces. We don't have those in Florida. We don't have the snow either. But what we do have is Deuk laser disc repair. So when I want to see Mount Fuji, I fly to Japan. When I want to see the monkeys in the hot tubs, I fly to Japan. When I want to visit my friends in Japan, I fly to Japan. But if you want the best spine surgery in the world, you come to Deuk Spine Institute in Florida. We just don't have more than one facility. We're a tiny company with very big ideas and big treatments and diagnoses. But we're not part of a big hospital chain. We're not some venture capital funded company that's got billions of dollars or millions of dollars. We're a small company that just happened to discover how to cure back and neck pain and how to fix spine problems the least invasive, safest way possible. And we're just here in Florida. We're a small company. It's 2024. Things will change. 2 years from now, we'll probably have a new building and we'll have a larger facility. And then maybe after 2026, maybe by 2030, we'll open another office in San Francisco so it's closer to Japan. But right now, we're just a tiny company.
And that is it for questions.
All right, I hope you enjoyed surgery. Our next patient has a very interesting back. He comes from Alaska. He's here in Florida, almost as far as Japan. And he is here for the Deuk laser disc repair. He has a couple of things. Number one, he has a herniated disc at L4-5. So that is the disc, not the bottom one, the one above, L4-5. And that disc is pushing out on both sides, crushing the nerves coming out the spine. And I got to go on both sides to fix it. He also has spondylolisthesis. We talk about this a lot. That's where the bones shift and slide. Other spine surgeons will tell you have to have a fusion. I used to believe the same thing. I did 1,000 fusions on people's lower backs. And then I realized you don't need to do a fusion to get rid of the patient's symptoms. You can fix them with a laser without doing a fusion. So now I do fusions on everybody, including spondylolisthesis, grade 1 and grade 2, which is 99% of spondylolisthesis, grade 1 and grade 2. So if you have spondylolisthesis, you have back pain, get the Deuk laser disc repaired. Stay away from metal. You don't want fusion. Fusion affects the movement of your spine permanently, and it creates scar tissue, muscle damage, all kinds of complications. Avoid fusion. I used to do them all the time. And the last thing I would say is that he has not just the disc problem, but he has facet problems. So he's got facet pain on the right side. and I'm going to go do the Deuk plasma rhizotomy on the right side. We're going to break that up as a second surgery, and we'll broadcast it as a separate surgery. Our third surgery for today is a patient with cervical facet pain,
Yep.
and we're going to do her in room 2, which doesn't have a broadcast system, so we will be silent for an hour. That gives you a chance to go have a lunch break or dinner break if you're in Japan, and we'll be back again for another surgery after that, actually 2 more after that. We have 6 surgeries today, full day. We started out with the knee, Deuk plasma rhizotomy for a patient with arthritis in the knees. Dr. Davis did both knees with the minimally invasive treatment that we offer now, and then we've got a few more cases. So